we're going to be looking at our breathing today. In order to train the breath and to have it work as smoothly as possible without a whole lot of forces acting on it, we're going to be on our backs. So we're going to go from our side, rolling from our side to our backs. Our feet can be comfortable on the floor, our knees can fall in on each other, or you're welcome to put the feet up on a chair so that you're resting this way. So this takes a lot of the gravity out of what's happening with the pelvic floor in a normal routine where we're standing or we're sitting. So it doesn't have a lot that it is working against in this position. So what you want to do is put your hand on your side, on the ribs, and put your other hand low on the belly, so in between the hip bones. We're nicely aligned here, neck is long. This takes a lot of the postural problems that create problems for our breathing on a daily basis, to take that out of it. So here we are. We're going to inhale through the nose and aim the air into both hands. And exhale just gently. Inhaling into the hands. Relaxing all the muscles of the pelvic floor. So relaxing in between the hip bones, in between the sits bones, in between the pubic bone and the tailbone with the inhale. Inhaling through the nose, aiming the breath into the hands. Every breath is going to be different. You'll find that the first couple you might get up in your upper chest, you might get a lot of shoulder movement here. We've created these breathing habits over decades, so if you're finding that you're having trouble with it, be patient with yourself. We're aiming the air to get expansion in the ribs and expansion in the low belly. The expansion in the low belly tells us that our pelvic floor is relaxing down because we're making room for that breath. What we'll do now is we're going to explore some tightness in the body. So you might find that you're not getting a lot of expansion in the sides. So what we'll do is lay on our side here, stacking the hips, knees, and feet. And we'll lay here with a hand on our side. So again, we've got our top two fingers on the bottom ribs. We'll move the bottom two fingers to below the ribs, and the thumb is at the back. So nice long line here from the back of the head to the tailbone. We'll inhale through the nose, looking for movement in all fingers and thumb. So we can add a pelvic floor contraction here. So we'll inhale. Then we're going to gather all points of the pelvic floor. So the attachment points are the pubic bone, tailbone, and sits bones. Gather those and lift them. So we're using the muscles to contract and lift as if you're drawing in a tampon, but you're gathering all those points and bringing them in. Inhaling into the hand. And exhaling through the mouth. Inhaling into the hand. We can blow and do that pelvic floor contraction. Inhaling into the hand. And exhaling, blowing. One more time this way. So what I want you to do here is when we're doing this breathing on this side, you're looking for what is moving here. So you might only get movement in the bottom fingers. You might only get movement in the top fingers. You might get nothing in the thumb. This is telling us where our areas of tightness are. Those things are going to be affecting our breath, affecting our posture, affecting how we move our body. So this is where we're doing that exploration, and it's important to find out where those spots are that we need to work on. So we'll inhale through the nose, keeping in mind what we're supposed to be doing here, looking for movement in fingers and thumb. And exhaling, drawing all points of the pelvic floor in and up. Inhaling through the nose. Good. So what's happening here? Are we getting any movement in the thumb? Are we even getting movement in the fingers, or is it all up in the chest and shoulders? If it is all up in the chest and shoulders, we're going to do some more exploration here. It's really all about training the brain to work with the body. So if we are breathing all up into our chest and our shoulders, we really just want to aim that air downward. Over time, it will happen. Just be patient with it. So what we can do now is go to the other side. And we're going to look for differences in this side compared to the other side. So once again, we've got our hips, knees, and feet stacked, and we're going to put our hand on our side. So we've got top 2 fingers on the bottom ribs here, bottom 2 fingers beneath the ribs, and the thumb at the back. And you can relax your head all the way down. So we'll inhale, thinking about making room for that breath in the pelvis. So thinking about that breath, making room for the pubic bone and tailbone to separate, and the sits bones to separate as well. Inhaling through the nose. And then exhaling, lifting the pelvic floor, so gathering from all points and blowing out. You'll feel your belly come in with that exhale. Inhaling, we're looking for that breath to make expansion all the way around. So in the fingers and thumb, we're looking for movement. And exhale, drawing the pelvic floor up. Inhale through the nose. And exhale. So make mental notes or actual notes about what is happening one side compared to the other side. And we are looking for expansion all around. The next video is going to be how we fix this lack of expansion in the sides, lack of expansion in the back.